Did you know that 2 in 5 homes in Minnesota have high radon levels? That's compared to only about 7% nationwide. We have very high radon levels in our homes, and this radon gas causes lung cancer. The good news is we can test for it, but let me tell you a little bit about what it is. It's a gas. It's a type of radiation. It's naturally present in our soil. You can't see it. You can't smell it. It moves up into our home through all the cracks and gaps and openings that exist in the foundations of our buildings. And when people are exposed to radon for a long period of time, it causes damage, it causes lung cancer. It is the second leading cause of lung cancer, estimated to cause 21,000 lung cancer deaths per year. Now, we'd like our radon exposure to be as low as possible. In the outdoor air, it's about 0.4. We recommend considering taking action at 2.0, and we highly recommend action at 4. Now, as I said, about 2 in 5 homes have high radon in Minnesota. This does differ a little bit across the state. Southern parts, western parts are a little higher. North central, northeastern parts are a little bit lower. But overall, we have high radon throughout the state. And that, again, is because there are openings in the foundations of our homes and buildings. Air moves through these openings, whether they're crawl spaces, sump holes, cracks, gaps in plumbing penetrations. The air that moves up through the home, that warm air, leaves through the attic, and it needs to get replaced somehow, and that's called the stack effect, where soil gases come in. Winds can affect radon levels and draw them in, as can mechanical equipment like fans. Now, any kind of home can have a problem, whether you have a basement or not, whether your house is new or old, whether your house is sealed and well insulated or not. The only way to know is to test. Now, the good news is it's easy to test. You can test your home yourself over the course of a couple of days. You can do a longer test if you wanted. You can hire a professional. And we brought some test kits today. We have them on the resource table in the middle. Help yourself to a test kit. Test your home. Now, unfortunately, a lot of people aren't testing. We need more people to test. Only about 1 in 100 homes were tested from 2010 to 2014. And really, it should be 100%. All homes should have been tested in that time frame. Now, if you find a problem in a home, from an engineering standpoint, it is easy to reduce radon with a pipe that's installed that draws air from under the house, and that air is vented to the exterior so the radon doesn't come in. And the good news is radon mitigation, or homes getting fixed, has been going up dramatically. In 2015, we saw at least 45 homes were fixed for radon. This is a good trend, but there are many hundreds of thousands of homes that need to be fixed. One impact has been from a law that requires disclosure and notification in home sales. This has caused that big increase, in large part is responsible for that increase. We also have a law that requires new homes be built radon resistant. However, this doesn't always work. This works to some extent in reducing radon, but these new homes still need to be tested, and we prefer that they have the fan installed during construction because it's not currently required. Another law that might get repealed that would increase the quality and consistency of radon measurement and professionals' work is the radon licensure law. There is a bill introduced that would repeal that. Hopefully that doesn't happen. Now, we work with over 100 different organizations. We like to work with you. We work with public health. We work with housing, medical, community groups, nonprofits, insurance providers. There's much we can do together to raise awareness and increase testing. So think about what you can do to increase radon awareness and testing. Consider asking your clients, your patients about radon. Have you tested your home? You can provide test kits. We give free test kits to our partners. There's a lot of different ways you can educate your clients, your patients, your customers through articles, using social media, using the press. Get us involved. Well, we'd love to work with you to increase awareness and testing. You can bring us out to your events. We're happy to do trainings, whether they're technical trainings for medical professionals. We do continuing education classes for different groups. We can talk and educate and train the general public as well. So please join us at the Radon working session. Bring your ideas on how we can increase awareness, how we can help increase testing, and ultimately This should lead to more homes being fixed, and that will prevent lung cancer. Thank you very much.